Yeah.
Hi, I'm Dr. Daniel from the Neuropathy Clinic at PhyxMe, and I'm here with Terry. Terry has signed up with our virtual program about 2 months ago, and so I'm just going to take Terry through some questions so that everybody can understand where he started, where he's at. I do want to ask right up front, Terry, have you been paid anything or induced in any other form or shape to give a testimonial?
No, I'm not Dr. Daniel.
Okay, thank you for that, and we have your permission to use your testimonial. Yes.
Yes, you do.
Perfect, perfect. Okay. And so first, just kind of like a quick summary of like where you were at or what you had done before you saw. So like what symptoms you were experiencing and who you had seen and where that left you.
Well, like I had actually starting like in October, I had been getting like severely inflamed, like to the point where I could hardly move. Literally I had like all sorts of joint pain. I had the neuropathy is getting harder and harder to sleep because of the neuropathy tingling, just a variety of problems with regards to my mobility, inflammation, and just overall well-being. Um, constantly tired and fatigued, and it has been, I was in a very miserable state, and I was not able to function the way that I wanted to.
Okay. And so where are you at now?
Well, right now, I'm like I've had significant different improvements. I had to use a walker or a cane to get around because of my weakness, poor balance,
Right.
inflammation. It was very painful to get up and around. And now I'm no longer using a cane or
Wow.
a walker to get around. I have regular mobility.
Wait,
I can
you're not using you're not even using a cane anymore?
No, I'm not using a cane
Wow.
or walker anymore because the inflammation has went down. I'm getting
Mhm.
better sleep because I don't have as much tingling and neuropathy. Now I'm not completely out of the woods yet.
Of course not. It's
Okay.
early. It's early.
But it's still like I'm in the upward spiral as far as my neuropathy goes. And I know when I go back to the Mayo Clinic to get checked for my neuropathy, there'll be significant improvements because I know where I was. They did the test on my neuropathy and and the sensitivity that I have. And I can feel things in my feet now that I hadn't felt in I don't know how long, maybe a couple years or
Oh
whatever.
wow. That's
So
awesome. That's
yeah, and so that is a significant improvement. My sleep has improved. It's not perfect yet. I still got, problems that I'm dealing with, but overall, my overall health is greatly improved. And best thing is that I got this little rock here, kind of symbolizes it, but I got hope now.
I love hearing that. I love hearing. So if you were to say like, how would you say you feel about your decision to take the leap and try the program?
Well, it definitely is a three-pronged program, and that's what I liked about it more than anything. It was based on nutrition, activating your nerves and circulation,
Yeah,
and then, applying, basic things or whatever, practices that will basically improve your overall health. So,
absolutely.
in other words, like eliminating the toxins, improving your nutrition, improving your circulation and nerve response. So both of the all combination of all three of those things, major things, has really enhanced the overall program. Because I know that if you're deficient on one thing, I've tried, some of these things independently,
Right.
and it doesn't
Exactly.
work. It's like a combination lock. You kind of need to get all three numbers to open up the lock, and
Absolutely.
um, that's what it is. So right now, like I can go and do a moderate workout. I can do some yoga. I can do a few things now that I hadn't been able to do before. and that's only going to improve my health before. And I'm can properly, because I can properly exercise now, I can sleep better, and then it's just this nice upward spiral. Now, it's like I said, it doesn't happen overnight, but it's a nice upward spiral of health as opposed to being on the downward spiral
Yeah,
where you're not
absolutely.
getting any information and things of that nature. So,
Absolutely. The direction,
um,
your direction is absolutely, I can remember our call, and I can remember getting off the call with you, and actually that moment, like where you made a decision and like your mood changed even then. And I was like, excited because I knew like really the biggest factor, and you probably know this because we talked about it, the biggest factor is the patient. And if a patient's
yeah,
committed to the program and works the program and follows the program, they're going to get results. And so how long have you been how long have we been working the program now?
it's been like over 2 months. I'm not quite as religious as probably I need to be, but I have to admit, like it's sort of like when I was marathon running, they gave us a whole list of rules and things to do. And if you didn't do the rules, like you pay immediately. So
Yeah,
I've known that when I've strayed just a little bit off maybe one or two items, and this is the thing with like fried food, the inflammation will stay with you 2 to 3 days.
yeah, for
Just
sure.
with fried food. So I was in a situation where like I was really hungry, kind of desperate, and I didn't have anything prepared. So I ate some fried food. Well, I paid for that. Okay. I
Right.
had to use the cane and the walker. It was almost immediate. Like it
Wow.
wasn't 2 or 3 hours later that I was using the cane and the walker. And this
Wow.
was just a couple weeks ago. So I know that there are certain toxic foods that I have to stay away from. And I'm sure that other people are experiencing the same thing that have the similar conditions that I have. Now I have non-alcoholic fatty liver disease, okay, which is very common. One in
Yep.
four people in America have this.
Yep.
But the thing of it is, if you don't address the toxic food, none of the other things are going to help you either.
Absolutely.
Okay. Like,
Absolutely.
you can't put a band-aid on, on a large wound if you're not going to sew it up and do the other things to like, and make
Exactly.
sure that it's clean and those sort of things. Putting a band-aid on it isn't going to help if you don't
Right.
do the other things. So,
Absolutely right. And so and as you mentioned, right, our program, I would argue, very well designed. It's easy to follow. It covers the three areas: the metabolic inflammation, the loss of circulation, the damage to nerves. So if you were to ask, so if somebody were to ask you, would you be able to recommend the program without reservation? How would you feel about that? Would you be able to do that?
oh yeah, I could totally. That's why I'm giving my endorsement because from my own experience, I know that it works, and
Awesome.
it's not going to be. I mean, I'm not somebody the point that was one step away from amputation, but I was at a point where literally I could not sleep, and the only way I would be able to sleep is by taking like Tylenol PM and those sort of things. So those things will further damage your liver and create more problems.
Absolutely.
And this helped, like I haven't had to take anti-inflammatories or painkillers or steroids like prednisone to like relieve, to get me back on a normal level.
Sure.
I've had, like that is pretty much pushed to the side. I don't have a problem now because I'm on, this process has worked, and
Absolutely.
that's all I can say is like that the supplementation isn't the end all be all, but pushes you up another level,
Right.
and then so does the infrared light therapy and the electrostatic therapy, and then your own basic nutrition.
Yeah.
So doing by doing this three-pronged approach, you're basically elevating your entire health as regards to like your ability to function normally.
And heal. Absolutely. Okay. Well, again, I appreciate you taking the time. I know it's a Friday and you took time out to speak with me. I appreciate that. I know everybody else who's watching appreciates that. And again, excited to see further improvements and hear about further improvements, Terry. Thank you so much for your time.
Oh, thank you, Dr. Daniel.
Okay, bye-bye.
Bye-bye.